If people are taking the vitamin itself, vitamin D over the counter, how much is it absorbing in our body? How much are we taking in?
Well, it's a fat soluble vitamin, so it absorbs better if you eat it with a fatty meal or just a regular meal.
Hmm.
It varies depending on the age, the color of the skin, and various diseases and what medications that you're on. So I would urge people to go to their doctor and get their vitamin D level checked. It's a
Hmm.
regular blood test, just a simple blood test, and you can get the results back in a lot of places that day or the next day. And I would, admonish people to get their levels checked at least once a year on doing their physical exam.
Because they never tell you that part. They don't even talk about vitamin D.
Well, actually, vitamin D has really only become mainstream the last 15 years because I was travel all around the world shouting off the rooftop, and I would talk to anybody that would give me 5 minutes about vitamin D. So it was not popular when I started out. Actually, a lot of doctors refused to draw the levels of the patients. So now I think everybody's been educated, or we're still educating some people about the importance of it. So it's a hormone. Hormone control how we interact with our environment. So if you don't have a hormone, which is an anti-stress hormone, so anytime the body is stressed, you need more vitamin D, not less vitamin D. So it helps your body interact with stress. So you heal faster, you have less pain, and you have fewer infections.
Wow. I mean, you have really, to be honest, Dr. Matthews, you've educated us because to be, if we knew this about stress, you're going to have people just knocking down the door, just going to buy it, trying to get their levels checked. Either that or
Well,
they telling people that's why you're stressed. My vitamin D is off.
well, remember I said you do have seasonal affective disorder this time of year because your vitamin D level drops 30%.
Hmm.
So some people do get depressed and moody during the winter months because
Yeah,
of less sunlight and they're not in the sun as much.
absolutely, absolutely. What would you like to tell people, or just the world, and let them know about vitamin D? What? Let's give some different things about it. All of these years that I mean, you have really been a champion for this.
Yes, yes, I have because it made a big difference in my patients' lives, and
Hmm.
they got well, they went home, and people with bad traumatic brain injuries that used to end up in a nursing homes, they're going back to school, college, graduating cum laude, getting
Mm.
promotions at work, and they're tax-paying citizens other than being dependent on taxpayers.
Hmm.
And they have a great quality of life. So, as a trauma surgeon, I thought my job was just not to fix the injury, but return people back to as normal a function as I could. So the thing that I like people really to know is that this is a hormone, number one. It's not a vitamin, and it works against all type infections. So get your levels checked. See your doctor once a year and get your vitamin D levels checked.
Absolutely. So not just go out and take it over, just go buy a whole bag of vitamin D. You need to get it checked.
Yeah, because it's a hormone, and then you can't have side effects. You have a thing called vitamin D toxicity where you can take too much. So you need to have your levels checked. And people with high calciums need to be careful with vitamin D because vitamin D can make your calcium go up if you're dehydrated. So it should be monitored by your physician at least once a year with a vitamin D level and a calcium level checked.